When we talk about low libido, most people instantly think of hormones, stress, or relationship issues. But what's often overlooked is how much our brain chemistry and attention patterns influence desire. For many adults, especially those living with ADHD, this connection can be surprisingly strong and confusing. It's not that the desire disappears completely, but rather that the brain struggles to stay present long enough to feel connected or aroused. ADHD isn't just about distraction, it's about how the brain processes motivation, reward, and stimulation. These same systems are deeply involved in sexual desire. When dopamine levels fluctuate, as they often do in ADHD, it can blunt the brain's ability to seek pleasure or maintain focus on physical intimacy. Imagine trying to engage intimately when your mind is constantly racing, jumping between tasks, or overwhelmed by sensory input. That mental overload can leave little space for sexual connection. It's not about lack of love or attraction, it's about cognitive exhaustion. Many people describe feeling mentally full by the end of the day, where even pleasurable activities feel like effort. Over time, this can lead to guilt or confusion because they can't understand why desire feels harder to access, even in emotionally satisfying relationships. Another layer to this is how ADHD affects emotional regulation. When emotions swing rapidly between highs and lows, the body doesn't always follow the same rhythm. Some individuals might experience brief spikes of desire during hyperfocus periods, followed by long stretches where libido feels completely flat. This inconsistency can be frustrating, not only for the person experiencing it, but also for their partner. It's important to recognize that these fluctuations aren't purely psychological, they're neurochemical. And then there's the role of self-esteem. People with untreated or poorly managed ADHD often struggle with feelings of inadequacy or self-doubt, especially when it comes to relationships. If intimacy feels like another area where they're falling short, avoidance can become a defense mechanism. Over time, this emotional distance is mistaken for loss of interest, when in reality, it's often exhaustion and overstimulation at play. Understanding this overlap is the first step in separating what's truly a libido issue from what's an attention and energy regulation challenge. Because when we start addressing the underlying neurobiology, not just the symptoms, that's when real healing and connection begin. When we move into the conversation about medications, things start to get even more complex. Many people seeking help for focus, mood, or hormonal balance are prescribed stimulants, antidepressants, or oral contraceptives, sometimes all three. Each of these treatments can individually influence libido, but together they can create a perfect storm for sexual side effects. What's tricky is that these medications are often essential for mental health and daily functioning, so patients may not realize that their low desire could be an unintended byproduct of the very treatments helping them feel emotionally stable or focused. Stimulant medications, which are commonly used for ADHD, work by increasing dopamine and norepinephrine in the brain chemicals tied to motivation and alertness. At first, some people may even notice a boost in energy and focus that translates into improved sexual interest. But over time, especially at higher doses, stimulants can cause appetite suppression, anxiety, or difficulty relaxing, conditions that make intimacy feel like a task instead of a pleasure. The body might be physically alert, but the mind is too tense to engage emotionally or sexually. Then there are antidepressants, particularly SSRIs and SNRIs, which are among the most commonly prescribed medications worldwide. While they are incredibly effective at stabilizing mood and reducing anxiety, they also elevate serotonin in levels, something that can suppress dopamine and dull sexual desire. Many patients describe it as feeling emotionally flat. They care about their partner, but that spark of sexual motivation just isn't there. It's not disinterest, it's chemistry, and when oral contraceptives enter the mix, another piece of the puzzle shifts. These pills can lower levels of free testosterone, the hormone most closely tied to sexual desire in both men and women. For some, this leads to reduced arousal or difficulty achieving orgasm, which can be misinterpreted as relationship strain rather than a hormonal imbalance. Combine this with the neurochemical effects of antidepressants or ADHD meds, and the result can be a significant drop in libido that feels sudden and confusing. What's crucial here is communication both with healthcare providers and partners. If a change in medication coincides with a change in sexual interest, it's worth bringing up. These side effects aren't a sign of weakness or incompatibility. They're a signal that your body's chemistry may need rebalancing. Recognizing that connection can be the first step toward restoring not only desire, but also confidence and emotional intimacy. One of the biggest challenges in understanding whether low libido is connected to ADHD or another cause lies in how easily the two are misdiagnosed or overlooked entirely. Too often, when someone mentions a decrease in sexual interest, the conversation stops at stress, relationship issues, or hormonal shifts. But for many, especially women, what's really happening beneath the surface is an undiagnosed or undertreated neurodevelopmental pattern that's affecting motivation, focus, and emotional energy. ADHD doesn't always look like restlessness or impulsivity. Sometimes it shows up as mental fatigue, difficulty staying engaged, or feeling disconnected during intimacy. These symptoms can mimic the emotional withdrawal associated with depression or anxiety, leading doctors to prescribe antidepressants rather than recognizing the underlying attention dysregulation. Unfortunately, this can create a frustrating cycle. Treatment for one condition ends up worsening another, particularly when those antidepressants lower sexual desire even further. For individuals living with ADHD, daily life can already feel like an uphill battle of managing tasks, emotions, and expectations. When libido starts to fade, it can amplify feelings of guilt or inadequacy, especially if they don't realize that their brain chemistry plays a major role. Partners may misinterpret this as rejection or emotional distance, while the individual feels pressured to perform despite feeling mentally drained. The result is a silent tension that impacts both connection and self-esteem. What makes this even more complicated is that sexual health isn't often part of ADHD evaluations or follow-ups. Many healthcare providers focus on managing attention and impulse control, but rarely ask about changes in desire, arousal, or satisfaction. Similarly, patients may feel uncomfortable bringing it up, fearing it's too personal or unrelated. This lack of open dialogue leads to countless missed opportunities for early recognition and support. It's essential to start viewing sexual health as an integral part of mental health, not separate from it. When we acknowledge that low libido can be a symptom of how the ADHD brain regulates energy and emotion, we can move away from blame and toward understanding. Because without proper recognition, people end up treating symptoms in isolation, never realizing that the true issue might be an invisible overlap between neurochemistry and intimacy. Recognizing that overlap isn't just about restoring desire, it's about restoring self-awareness and connection. Addressing the overlap between ADHD symptoms and low libido requires more than simply adjusting medications or forcing desire. It calls for a holistic, compassionate approach that honors both the brain and the body. True healing begins when we understand that libido isn't just a physical response. It's a reflection of mental energy, emotional safety, and hormonal balance. When any of these are off, desire naturally fluctuates. That's not failure, it's biology. The first step is creating space for open, judgment-free conversations. Many people hesitate to discuss sexual changes because they fear being dismissed or misunderstood. But when these concerns are brought up honestly, with a healthcare provider who looks at the full picture, it becomes easier to identify what's driving the issue. Sometimes it's the medication dosage or combination. Other times it's unmanaged stress, poor sleep, or underlying emotional exhaustion that's dimming that spark. From there, treatment becomes about balance, not blame. A collaborative plan might include adjusting medications, considering non-hormonal birth control options, or exploring therapy that supports emotional regulation and intimacy. Cognitive behavioral strategies, mindfulness, and lifestyle shifts, like improving sleep hygiene and exercise, can all enhance dopamine balance and, in turn, sexual motivation. For some, working with a sex therapist or relationship counselor helps rebuild connection and confidence without pressure or shame. It's also vital to bring partners into the process, understanding that low libido can stem from neurobiological factors, not disinterest, fosters empathy instead of resentment. When couples work together communicating openly about energy levels, timing, and comfort, they often rediscover intimacy in new, more emotionally grounded ways. The goal isn't to return to a perfect sex life, but to build one that reflects mutual understanding and realistic rhythms. Ultimately, sexual wellness is a dynamic part of overall health. When we start to treat it that way, addressing both the physical and psychological influences, we give ourselves permission to heal more completely. Restoring desire isn't just about reigniting passion, it's about reconnecting with one's own body, energy, and self-worth. And that's where the path to true intimacy begins.